only program like this in the country. So they get a very complete vocational rehab experience once they get here. So like I was saying, the service member or veteran can expect to leave here either knowing that they can go back to the military, or they can know what school they may be going to once they get out of the military, or as a veteran, they may know where they're going to go when they go back to the community in the form of a job.
As the medical director, I work directly with the patient and the team. One, it's our unique approach with our emphasis on vocational therapy, and also it's the dedication and all of our team members that really have bought into our mission and our treatment plan with each patient. And I think one of the most amazing things about it is the how individualized each plan is, and how we will do whatever we can to help that patient achieve their goals.
This is not everyone is sitting at their desk, you come in for an hour an appointment. This is a very active team, medical team, that's ready to help you with your transition. A transition to civilian employment, a return to duty, and or a transition to education.
Patients have returned to duty. Patients have initiated education programs. They have obtained professional certifications while in the program. They have obtained job offers while in the program. So there's been a lot of really wonderful outcomes for the individuals who really took it seriously and used this program for what it's here for.
If we come in with a vocational goal, our team is dedicated to helping and supporting that in every therapy, whether it's occupational therapy, physical therapy, speech therapy, of course the medical services, and we have consulting services that are available through vision, and maybe a few that are assistive technology. So we all work together towards that person's transition goals.
Physical therapy within the S.T.A.R program has many different layers. While we do traditional rehab in the clinic, gait training, strength training, balance, coordination, we also incorporate alternative types of exercise like yoga, pool therapy. We also try to interact with other therapies like recreational therapy, occupational therapy, and do community reentry. We work with a variety of injuries, from traumatic brain injury, amputees, cerebral vascular accidents, strokes, just musculoskeletal orthopedic injuries, just different types of polytrauma injuries. Patients can come in here on a wheelchair, and a lot of times over the 3-month, 4-month stay that they're in the program, they progress through their physical therapy and get to a point where they are independent with walking, no longer needing assistive devices, and some of them are even able to get back to some of their extracurricular activities like running or other types of sports activities.
Every service member that comes through our doors is different, so I'd never do the same treatment session twice a day. I spend a lot of time working with these individuals on increasing their independence and success with daily living tasks such as cooking, shopping, financial management, household management. I do a lot of sleep hygiene education, and we will also work on visual scanning and motor reaction timing to increase their success and independence with tasks like driving, looking for what you need in the grocery store. I work a lot with the vocational rehab counselors, and I like to go on worksite visits with them and do an activity analysis so that I can see what sorts of tasks and demands the client has to do when they're on the worksite, and then bring that back to the clinic and try and simulate that so they have more practice before they need to go out there and do it in real life.
I provide psychotherapy for the patients. Often because the patients are here an average of about 3 months, we do more short-term psychotherapy. A lot of what we see here are comorbid, some PTSD issues, depression, anxiety, and often a lot of adjustment issues. Patient is, may have just sustained an injury, and then now they're trying to figure out what do they do. They have a lot of things going on where they're transitioning with the family as well. So that being said, not only do we do an individual therapy, but we try to get the families involved to kind of help with this adjustment process. And just recently, we started a mindfulness group and Qigong group, and I really enjoy it. We do Tuesday mornings, and the patients come, and I teach them some Qigong, which is really helps with mindfulness and relaxation. And then our speech therapist does some mindfulness as well.
I do both traditional speech therapy, which involves anything from if you're having a hard time with swallowing, but also working on voice, and your voice may have some sort of injury after an accident, but also just being able to have good articulation. So you might have a dysarthria or something like that, which can impede your ability to return to school or work. And then we go into a lot of the cognitive stuff, and that's memory, attention, and then executive functioning, which is working on things like your social skills, being an assertive communicator, being able to plan things out, organize yourself, all of those things that you need just to live a productive life.
I provide recreation therapy services to our S.T.A.R patients here. Those services include activities that are based around leisure participation as well as community reintegration. Recreation therapy is very unique simply because it is based on the person. It is based on the leisure activities. We can get 10 patients in this building, and all 10 of them will have very different leisure perspectives, leisure interests. And finding a way to make that work for every single person is one of the benefits about my job, and it's one of the things I enjoy. Oftentimes, we, in the community, we will participate in activities such as therapeutic horseback riding, service dog training. We may go out to do different art activities with the local visual arts center. We've done a wide array of activities with local organizations, some national organizations, and they provide great outlets for our patients.
I feel like all of our patients are success stories. We've had folks who've come here just itching to get back to duty, and we're able to help them meet that goal. We've had folks come here who have no idea what they want to do or what they want to pursue, and they're feeling kind of lost. And so not only are we fixing them up from a physical standpoint, but we're helping them figure out what their life's going to be like educationally and vocationally once they leave here.